Good evening. So today's topic is diabetic eye diseases. Well, in diabetes, I think everybody knows that in diabetic, the chances of infection is very high. So in the eye, if there is any infection in any part of your eyes, like for example, in the lids, if you have infected striae, that is known as potential external, or any infection in the sclera or conjunctiva, often on recurrent conjunctivitis, scleritis, episcleritis, or vitritis, or orbital These are all infection in the different parts of the eye wall. So whenever you have this part like that, you should do blood sugar fasting PP, very important. And especially those who are having diabetes, you should do glycosylated, which tells you about the last 6 months blood sugar. Now, which are the main diseases of diabetes in the eye? Main is about diabetic retinopathy. Now, what is exactly diabetic retinopathy? In diabetic retinopathy, exactly what happens in the blood vessels? The permeability of the blood vessels are increased. And because of that, the serum of the blood comes out and comes to the retina, which causes the edema of the retina. In that case, you will see some changes in the retina that will be examined by the ophthalmologist. And see some small hemorrhages, exudates, some microinfusions. This is type of a non-proliferative. There are no new blood vessels in this case. During this time, you can always go for a photocoagulation and prevent further progress of your diabetic retinopathy.
Hello and namaste from Mumbai. And Dr. Pushpa already discussed about all the clinical pathological processes involved in diabetic eye. And I'm here to talk to you about the homeopathic approach. The main thing about homeopathy is it based on very, very classical principles, the principles of holism, individualism, the principle that different parts of the body is connected wholly to a central part, to the idea that like cures like, to the idea that we find a homeopathic remedy based on studying the entire history of a person from childhood till now, understanding their state of mind, their genetic history, past history of illnesses, their stressful situation, how they have kind of reacted in different situations, their core central pattern. And once we do that, we choose a homeopathic remedy that can help. Now, we have been able to treat quite a few cases, ophthalmic cases, typically diabetic eye cases in homeopathy in the past decade, in the last century, by different homeopaths across the globe. And definitely in homeopathy, we have to find the remedy for the person. However, there are certain homeopathic remedies which will be more often kind of associated in this kind of disease than other remedies. One of the commonest homeopathic remedy is the remedy phosphorus. The phosphorus remedy is one of the top remedy for diabetic retinopathy and diabetic ophthalmic disease. The other very important remedy, which is a little lesser known, is sickle cord, which is also a very important remedy. The snake remedies, the lachesis, the crotalus horridus. I've used crotalus horridus in many retinal diseases with very interesting results. And finally, the remedy uranium nitricum. So different homeopathic remedies, but the cornerstone of homeopathy still remains individualization. In many cases, we are able to stop the progress of the disease or slow down the progress of the disease, and that itself is a very big achievement. However, along with homeopathy, we have to look at the root cause of the problem and look at the lifestyle changes that the patient can do, the nutrition changes that we can do, the sleep patterns, the movement and exercise and yoga that they can do. And when done all of this together in a holistic way, in an integrated way, really we can make a big difference in people's life. So take benefits of homeopathy and integrated treatment in ophthalmic cases and in other cases, and spread the word around to help as many patients as we could. Thank you so much. And namaste. These are the contact details. You can write to us for urgent consultation details. You can come in person here in Mumbai at our clinic in Mahim, or we can even have an online video call appointment. Thank you.